Welcome to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be talking about a recovery-oriented system of care, and our special guest is Santita Prather with the Frederick County Health Department's Behavioral Health Services Division, where she's a program specialist. Santita, welcome and thank you for joining us.
Thank you, Dr. Brookmeyer.
First, I guess we should start off with what is a recovery-oriented system of care?
Well, the recovery-oriented system of care, also known as ROSC, is a new approach to working with people who are recovering from alcohol and drug addiction. So it's not really a program, but more like a philosophical or conceptual framework for working with people who are in recovery. It was established at the national level in 2005 through the Substance Abuse and Mental Health Services Administration, also known as SAMHSA. And more recently, in 2010, the Frederick County Health Department received a grant through SAMHSA and began to implement this model here locally in Frederick County.
Well, that's very exciting to hear that we're on the cutting edge
Yes.
of what is thought to be really the best practice and where we should all be going throughout the country.
Yes, yes.
Yeah. So what are the components of this framework?
Well, there are very specific elements and principles that really drive the ROSC model. And one of the first elements that I'd like to talk about is that it is person-centered, meaning the person is at the center of their recovery, it's self-directed, they're empowered to make choices about their recovery, so they're kind of in control of the process. And then another concept that I'd like to talk about is that there are multiple pathways to recovery. No two people would have the same recovery plan. Each person is unique and they bring their culture and background to the table. So that's very important to the recovery process.
Mm-hmm. Well, that sounds like a big difference from the model, the predominant model in the past, where it was maybe like a one-size-fits-all.
Yes, very different. And so we really do want to look at the individual and just empower them to be a part of this process.
Mm-hmm. Are there other components that you'd like to elaborate on?
Yes, one of the other components that I like to highlight is that the community is a very important piece of a person's recovery. We want the community to work together, so we want it to be embedded in the community. And there is a continuum of care that's out there, whether it's treatment to recovery support. And it's very important that these systems work together so we can ensure there's a continuity of care for this individual.
Mm-hmm. And so I understand that the health department is looking to expand this system of care out in the community, and my guess is you'll probably be looking for some volunteers. So can you tell us a little bit about the interest in expanding the services to be available to more persons?
Yes, but I do want to point out one thing, and this is important to our volunteers. Using peers and allies in the recovery process is a very important part of the person's recovery. Peers are individuals who have struggled with addiction and they understand the barriers to the recovery process. And then we have allies, and those are individuals like family members or friends who have watched somebody really struggle with addiction and they kind of understand what it takes as well. And so we're looking for peers and allies to come volunteer at the health department, and we have 3 different volunteer positions that are available. Mm-hmm. So I'd like to talk about the 3 positions.
Okay, great, and especially if there are certain qualifications for
Exactly,
those.
exactly. So the first position we're looking for is called telephone recovery support, and there is evidence that supports that more frequent contact to people in recovery, those individuals will have a higher success rate. And then the next area that we're looking for is recovery coach. That's someone who's like a peer or ally, and they would work closely with someone one-on-one, just mentoring them and coaching them along their process. And then the last volunteer position we're looking for recovery center support. So as you mentioned, we're looking to expand our services, and we have 1 center location. So at some point, we'd like to be able to expand into other areas and also expand our center hours. And as far as qualifications, really, we're looking for people who have a good understanding and knowledge of addictions and recovery. And if someone wants to be a recovery coach, we would like them to have at least 18 months of sobriety.
Mm-hmm. And you offer training for the recovery coaches?
Yes, we do have. We have a week-long training that we offer for our recovery coaches. We had our first one recently, and it went very well. And we're looking to schedule one probably mid-summer. And then we're going to have ongoing volunteer training for our ROSC volunteers.
Mm-hmm. And what kind of time commitment would volunteers be looking at?
That's the great thing about being a ROSC volunteer. It really does depend on the person. And what they have available is what we'll take. So, if they have a limited time, that's fine. If they really like to just dig in and get involved, that would work for us as well.
Mm-hmm. So if somebody does want to get involved, or at least learn a little bit more about ways to get involved, or learn about the conceptual framework of a recovery-oriented system of care, not just one provider, but a system of care that's coordinated, how can they find out more?
Well, they can contact us at email at ROSC@frederickcountymd.gov, or they can contact us at 301-600-3686.
Great. Well, thank you for a lot of really good information. One, to let people know that here in Frederick County, we are moving forward
Yes.
and actually offering what probably individuals and families have said for a long time is there's no one way.
There is no one way.
And so we're helping to support the community and community service providers in offering recovery services, treatment recovery services to better meet the needs. And you're looking for volunteers,
Yes.
people who want to give back to the community and help.
Well, thank you. Thank you for having me today.
Great. Thank you very much. And now please stay tuned for this month's Medical Myths. And now here's this month's Medical Myths. Welcome to this month's Medical Myths. We'll be talking about skin cancer, and here are some myths from the American Cancer Society and the Cancer Foundation. The first myth is tanning at a salon is safer than tanning outdoors because it's a controlled dose of UV radiation. Well, the fact is, compared to people who have never tanned indoors, indoor tanners have a higher risk of all forms of skin cancer. One report indicates that frequent tanners using high-pressure sun lamps may receive as much as 12 times the annual, that's the whole year's worth of UVA, ultraviolet A dose that they would otherwise receive from the sun. Myth: you can't get sun damage on a cloudy day. Well, the fact is, just because you can't see your shadow doesn't mean you're safe from the sun's damaging rays. Believe it or not, up to 80% of the sun's UV rays can penetrate through clouds and fog. That includes winter days too. Another myth is that people believe a base tan protects your skin from sunburn. The fact is, there is no such thing as a safe or protective tan. Any tan at all is a sign of skin damage. Skin tans, in response to UV damage to the skin's DNA. A tan is the skin's attempt to repair sun damage and prevent further injury. But these imperfect repairs can cause gene defects that can lead to skin cancer. Another myth is that people believe that if they use a sunscreen with an SPF of 50, they're all set. Well, a sunscreen's SPF, which stands for Sun Protection Factor, indicates that it protects against UVB rays, but you also need to make sure you get protection from UVA rays. So, for effective protection, apply a broad spectrum, that's a UVA and UVB sunscreen. Apply a generous amount of it, and reapply every 2 hours, and also after swimming, toweling dry, or sweating. The final myth is that people of color don't get skin cancer. The fact is, people of color are less likely to develop skin cancer than Caucasians, but they have a higher risk of dying from it. There's one type of a very dangerous and fast-spreading skin cancer known as acral lentiginous melanoma, and it's more common among darker-skinned people and may appear as a suspicious growth in the mucous membranes, under the nails, or on the palms or soles of the feet. Whatever your skin color, protect yourself. In summary, there is no such thing as a safe tan. That's this month's Medical Myths. And now here's Angie Blair with this month's health tip.
Hello, this is Angie Blair, health educator with the Frederick County Health Department. Welcome to this month's edition of Health Tips. May 19th has been designated as National Hepatitis Testing Day in the United States. This is an opportunity to remind healthcare providers and the public about who should be tested for chronic viral hepatitis. Millions of Americans have chronic viral hepatitis. Most of them do not know they are infected. About 80,000 new infections occur each year. Hepatitis is a liver disease that makes your liver swell and keeps it from working correctly. Several viruses cause hepatitis. The most common types are hepatitis A, B, and C viruses. Hepatitis A is spread through food or water contaminated by feces from a person who has the virus. You can get hepatitis A by eating food prepared by someone with the virus. You can also get it by drinking water in parts of the world with poor sanitary conditions. Hepatitis A vaccination is recommended for all children starting at age 1, travelers to certain countries, and others at risk. Hepatitis B is spread through contact with an infected person's blood, semen, or other body fluid. You can get hepatitis B by having sex with an infected person without a condom, sharing drug needles, or sharing a toothbrush or razor with an infected person. A woman with hepatitis B can give the virus to her baby at birth. Hepatitis B vaccination is recommended for all infants, older children, and adolescents who were not vaccinated previously, and adults at risk for hepatitis B infection, such as those who have sexual contact with an infected person, have multiple sex partners, have a sexually transmitted disease, are men who have sexual encounters with other men, inject drugs or share needles, syringes, or other injection equipment, live with a person who has hepatitis B, are on hemodialysis, are exposed to blood on the job, are infants born to infected mothers. Hepatitis C is spread through contact with an infected person's blood. You can get hepatitis C by sharing drug needles or getting pricked with a needle that has infected blood on it. There is no vaccine for hepatitis C. Testing for hepatitis C is recommended for people who currently inject drugs, injected drugs in the past, even if it was just once or occurred many years ago, have HIV infection, have abnormal liver tests or liver disease, received donated blood or organs before 1992, have been exposed to blood on the job, or are on hemodialysis. Hepatitis B and C cause nearly 1 million deaths each year worldwide. Chronic viral hepatitis is a silent killer. Without testing for infection, many people are not aware that they are infected until symptoms of advanced liver disease appear. Advanced liver cancer has a 5-year survival rate of less than 5%. Early detection is critical. If you have questions about hepatitis infection or vaccination, talk with your doctor. More information is also available from the Centers for Disease Control and Prevention. Thank you for tuning in to this month's Health Tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.